Hi everyone, welcome back to my YouTube channel and today we are going to talk about Norma Lateralis. So let's start the topic with introduction. Norma Lateralis refers to the lateral view of the skull. It shows both cranial and facial bones along with several important landmarks, sutures and foramina. This view is essential for understanding the external architecture of skull, studying muscular attachment and identifying surface landmarks used in surgery and forensic studies. Bone scenes from normal lateralis include frontal bone, parietal bone, occipital bone, temporal bone, sphenoid bone, zygomatic bone, maxilla, and mandible, and also nasal bones. Frontal bone here is the anterior part of the cranial vault. Parietal bone forms are the large bones that form the lateral wall of the cranium. Occipital bone forms the posterior inferior portion of the cranium and it is partially visible from normal lateralis. Temporal bone is the parts visible include squamous part, tympanic part, mastoid part, and zygomatic parts. Sphenoid bone's greater wings is visible from the normal lateralis. Talking about zygomatic bone, it is visible forming the prominence of cheek. Maxilla is visible forming the upper jaw, and mandible forms the lower jaw with ramus and body. And nasal bone is seen as a small part that is seen anteriorly. Landmarks and regions of normal lateralis. It has regions include cranial vault, then it has temporal bone region, orbital and zygomatic regions, maxilla and mandibular region, and then we will talk about fossa seen from the normal lateralis. First, we will talk about cranial vault region of normal lateralis. It has temporal lines that include superior and inferior temporal lines that are curved ridges on parietal and frontal bone that make attachment of temporalis muscle. Second feature at the cranial vault region is pterion, that is H-shaped junction of frontal, parietal, sphenoid, and temporal bone. This pterion is clinically important because the middle meningeal arteries lies beneath it. Second region of normal lateralis is temporal bone region. It has external acoustic meatus that is opening for ear canal. Second landmark here is mastoid process that is conical projection for muscle attachment. Third landmark here is styloid process that is slender projection for ligament and muscle attachment. Fourth landmark here is zygomatic process that forms the zygomatic arch with the zygomatic bone. Third region of normal lateralis is orbital and zygomatic region. In this region, orbits are partially visible laterally, and then there is zygomatic arch there that is formed by temporal and zygomatic bone that serve as a bridge over the temporal fossa. Fourth region of is maxilla and mandible. Maxilla show the infraorbital foramen from normal lateralis, and mandible shows ramus, body, angle, coronoid process, condylar process, articulating with temporal bone, and also it shows mental protuberance. Now let's talk about fossa seen from normal lateralis. They include temporal fossa, infratemporal fossa, and pterygopalatine fossa. Temporal fossa is present above the zygomatic arch and it houses the temporalis muscle. Infratemporal fossa is present below and behind the zygomatic arch and it is partially visible from normal lateralis. And then pterygopalatine fossa, that is small area that is deep in the skull and it is partially visible through the normal lateralis. Suture scenes in normal lateralis include coronal suture, lambdoid suture, squamosal suture, sphenoparietal suture, and zygomaticotemporal suture. Coronal suture is suture between frontal and parietal bone. Lambdoid suture is suture between parietal and occipital bone. Squamosal suture is suture between parietal and temporal bone. Sphenoparietal suture is suture between sphenoid and parietal bone, and zygomaticotemporal suture is suture between zygomatic and temporal bones. Foramina scenes from normal lateralis include supraorbital foramen, infraorbital foramen, and mental foramen. Supraorbital foramen is present in frontal bone above the orbit. Infraorbital foramen is present in maxilla below the orbits, and then there is mental foramen that is present on the anterior area of the mandible. Clinical significance of normal lateralis. First is pterion, that is a weak spot in the skull, and fractures here may cause extradural hemorrhage due to rupture of middle meningeal artery. Second significance is zygomatic arch that serve as a landmark for surgeries of temporal and infratemporal region. Third significance is the mandibular landmarks that are important in dentistry and maxillofacial surgery. Fourth significance is norma lateralis is used in forensic anthropology for skull identification and sex estimation. Conclusion of this lecture video. Norma lateralis is the side view of skull, reveals a combination of cranial and facial bones, along with critical landmarks like the pterion, temporal fossa, zygomatic arch, and mandibular structures. It is of great importance in anatomy, surgery, radiology, and forensic studies for understanding clinical architecture and clinical correlations. And this is all about normal lateralis. Hopefully you like the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.